The Horse Racing Integrity and Safety Act of 2020 was a landmark legislation that aimed to improve the integrity and safety of horse racing by requiring uniform safety and performance standards, including a horse racing anti-doping and medication control program and a racetrack safety program, to be developed and enforced by an independent horse racing integrity and safety authority. The act was passed by the House of Representatives on September 29, 2020, and by the Senate on December 21, 2020. It was signed into law by President Donald Trump on December 27, 2020. The act recognized the authority as a private, nonprofit corporation with a board of directors composed of representatives from various sectors of the horse racing industry and independent experts. The authority was also required to establish 2 standing committees, an anti-doping and medication control standing committee and a racetrack safety standing committee, to provide guidance to the authority on the development and maintenance of the programs. The Federal Trade Commission, FTC, was given oversight over the authority and its programs. The authority was required to submit to the FTC any proposed rule, standard, or procedure developed by the authority to carry out the horse racing anti-doping and medication control program, or the racetrack safety program. The FTC was required to review and decide whether to approve or disapprove such proposals within 90 days of submission. The horse racing anti-doping and medication control program aimed to ensure fair competition and protect the health and welfare of horses and jockeys by prohibiting the use of performance-enhancing drugs and other substances that may affect the outcome of a race or endanger the safety of horses or humans. The program also included testing procedures, investigation and disciplinary processes, reporting requirements, and education and research initiatives. The authority was required to seek an agreement with the EU Anti-Doping Agency or an entity equal in qualification to act as the Anti-Doping and Medication Control Enforcement Agency under the program. The racetrack safety program aimed to establish uniform standards for training and racing conditions that are consistent with the humane treatment of horses, such as track surface quality, injury prevention and reporting, veterinary care, racing equipment, environmental factors, emergency preparedness, and licensing and accreditation. The program also included inspection and enforcement mechanisms, investigation and disciplinary processes, reporting requirements, and education and research initiatives. The act applied to all thoroughbred horses that participate in covered horse races in any state. A covered horse race was defined as any horse race that is subject to regulation by a state racing commission, involves wagering under state law, includes 2 or more horses, has a minimum purse amount determined by the authority, or is designated as a covered horse race by an interstate compact. The act also allowed other breeds of horses to opt into the act by election of their state racing commission or breed governing organization. The act was supported by various groups within the horse racing industry, such as the Jockey Club, Breeders' Cup Limited, Keeneland Association Inc., Churchill Downs Incorporated, New York Racing Association Inc., National Thoroughbred Racing Association Inc., Stronach Group LLC, Del Mar Thoroughbred Club Inc., Thoroughbred Owners of California Inc., Thoroughbred Owners and Breeders Association Inc., Water Hayotes Alliance Inc., Kentucky Thoroughbred Association Inc., Kentucky Thoroughbred Owners and Breeders Inc., Coalition for Horse Racing Integrity Inc., American Association of Equine Practitioners Inc., Animal Wellness Action Inc., Animal Wellness Foundation Inc., Humane Society Legislative Fund Inc., Humane Society Veterinary Medical Association Inc., Humane Society of the United States Inc., ASPCA, American Society for Prevention of Cruelty to Animals, National Horsemen's Benevolent and Protective Association Inc., Thoroughbred Horsemen's Association LLC, Maryland Thoroughbred Horsemen's Association Inc., Illinois Thoroughbred Horsemen's Association Inc., New Jersey Thoroughbred Horsemen's Association Inc., Pennsylvania Thoroughbred Horsemen's Association Inc., Indiana Horsemen's Benevolent and Protective Association Inc., Iowa Horsemen's Benevolent and Protective Association Inc., Minnesota Horsemen's Benevolent and Protective Association Inc. Nebraska Horsemen's Benevolent and Protective Association Inc. North Dakota Horsemen's Benevolent and Protective Association Inc. Oregon Horsemen's Benevolent and Protective Association Inc. Washington Horsemen's Benevolent and Protective Association Inc. West Virginia Racing United LLC. The act was opposed by some groups within the horse racing industry, such as United States Trotting Association, USTA, Harness Tracks of America, HTA, American Quarter Horse Association, AQHA, National Horsemen's Benevolent and Protective Association, HBPA, Arizona HBPA, Arkansas HBPA, Charlestown HBPA, Colorado HBPA, Finger Lakes HBPA, Florida HBPA, Louisiana HBPA, Michigan HBPA, Montana HBPA, Mountaineer Park HBPA, New Mexico HBPA, Ohio HBPA, Oklahoma HBPA, Ontario HBPA, Tampa Bay Downs HBPA, Texas HBPA, Thoroughbred Racing Associations, TRA, National Steeplechase Association, NSA, National Barrel Horse Association, NBHA, National Reining Horse Association, NRHA, National Cutting Horse Association, NCHA, National Rein Cow Horse Association, NRCHA, Ranch Sorting National Championships, RSNC, Barrel Futurities of America, BFA, Better Horses LLC, Equine Equipment LLC, Horseman Labor Solutions LLC, International Sound Horse Conference, National Animal Interest Alliance, NAIA, Performance Horse Development LLC, Protect the Harvest, Rood and Riddle Equine Hospital, and U. Equestrian Federation UCF. These groups argued that the act would impose unnecessary federal regulation on an industry that is already regulated by state authorities, that it would create a costly and burdensome bureaucracy that would divert resources from other priorities, that it would unfairly favor certain segments of the industry over others, that it would infringe on states' rights and sovereignty, that it would violate constitutional principles such as due process and equal protection, that it would undermine existing programs and initiatives that have improved horse racing integrity and safety, that it would jeopardize the livelihoods of thousands of people who work in the industry, that it would harm the diversity and innovation of horse racing in different regions, that it would ignore the differences among various breeds and disciplines of horses, that it would disregard the scientific evidence and expert opinions on medication use and testing, that it would endanger animal welfare by banning therapeutic medications that are necessary for treating injuries and illnesses, that it would expose horse owners to liability risks without adequate safeguards, that it would create conflicts of interest among some of its supporters who stand to benefit financially from its implementation, that it would lack transparency and accountability in its governance structure, that it would be vulnerable to legal challenges, and that it would fail to address some of the root causes of horse racing. Problems such as overbreeding, lack of funding for aftercare programs, insufficient veterinary oversight, inadequate track maintenance, inconsistent racing schedules, insufficient education and training for industry participants. The creation of a national regulator for horse racing in the U.S. was a long-awaited and hard-fought victory for many in the industry who wanted to see more uniformity and accountability in the sport. However, the Horse Racing Integrity and Safety Authority, HISA, which was established by Congress in 2021, still faces many legal and political challenges that could undermine its authority and effectiveness. One of the main obstacles facing HISA is the opposition from some state racing commissions, which have traditionally been the regulators of horse racing in their jurisdictions. Some of these commissions have filed lawsuits against HISA, arguing that it violates the 10th Amendment of the U.S. Constitution, which reserves powers to the states that are not delegated to the federal government. They also claim that HISA is an unconstitutional delegation of legislative power to a private entity that is not accountable to the public. Another challenge for HISA is the resistance from some segments of the industry, such as owners, trainers, breeders, and veterinarians, who may not agree with some of the rules and standards that HISA will enforce. For example, HISA will ban the use of race day medication for horses, such as Lasix, which is a diuretic that prevents bleeding in the lungs. Some in the industry argue that Lasix is necessary for the health and welfare of horses, while others contend that it is a performance-enhancing drug that masks injuries and gives an unfair advantage. A third challenge for HISA is the pressure from animal rights activists, who have been vocal critics of horse racing and have called for its abolition. These activists have exposed cases of doping, abuse, neglect, and fatalities of horses in the industry, and have demanded more transparency and accountability from regulators and stakeholders. They have also lobbied for legislation that would ban horse slaughter and protect retired racehorses from being sent to slaughterhouses. A fourth challenge for HISA is the lack of funding and enforcement resources to carry out its mission. HISA will rely on fees collected from state racing commissions to fund its operations, but these fees may not be sufficient to cover its expenses. HISA will also need to hire qualified staff, inspectors, testers, and investigators to monitor and enforce compliance with its rules and standards across dozens of states and hundreds of racetracks. HISA will also need to coordinate with other federal agencies, such as the Federal Trade Commission and the U.S. Anti-Doping Agency, to ensure consistency and cooperation. These are some of the current and future legal and political obstacles facing the national regulator of horse racing in the U.S., which will have a significant impact on the future of the sport. Will HISA be able to overcome these challenges and bring more integrity and safety to horse racing? Or will it face more resistance and litigation that will hinder its progress and effectiveness? Only time will tell.